For us in Hong Kong with more on this. We're looking at Southeast Asia now as being a global epicenter for the virus. How, I guess, did it get this bad, and what's the very latest in these countries?
It's bad and it's getting worse. Fueled by the highly contagious Delta variant, COVID-19 is taking more and more lives across Southeast Asia, including Thailand and Myanmar. Thailand on Wednesday reported a new record high in daily coronavirus cases. The number 16,533 new cases of the virus reported this day, and they're running out of beds in Bangkok. Officials in the Thai capital say that the demand for beds is 3 times over capacity. That has prompted health officials there in the Thai capital to issue a statement saying that they're overwhelmed and under immense pressure. We'll bring up the statement for you. In it, the Public Health Ministry Director General in Thailand says this, quote, "Our doctors, nurses, and other frontline medical staff are working at their best. They're more than willing to take care of every patient, but we have to ask for your kind understanding. The beds now really overwhelmed," unquote. Now, to deal with the spike in infection, Thailand has announced that they are currently in the process of converting disused train cars into a COVID-19 ward. In fact, this is the idea, is that they plan to take over a dozen, about 15 old railway carriages and convert them into a 240-bed isolation ward for patients who have lesser symptoms of the virus. Now, we're also monitoring the situation in nearby Myanmar. The COVID-19 crisis continues to deepen there. For months now, social welfare groups have been saying the pandemic has gotten worse in Myanmar ever since the military coup that took place on February the 1st. People who are suffering with symptoms of COVID-19 in Myanmar are choosing to stay at home or to seek out private clinics or independent doctors because they simply do not trust the military. And the military in Myanmar is now arresting doctors and medics who are independently caring for people maybe suffering from COVID-19. This has prompted a UN expert to issue what he is calling a COVID ceasefire in Myanmar. Let's bring up the statement for you from Thomas Roberts. He is a UN Special Rapporteur on Human Rights in Myanmar. He says the UN must act immediately to halt the military junta's attacks, harassment, and detentions in the midst of a COVID-19 crisis, unquote. And just adding to the misery in Myanmar, there's massive flooding underway. It's displaced hundreds of people in the country. Thousands of people remain in the flood zones. We've been monitoring social media footage showing medical workers, frontline staff holding bedridden patients still attached to oxygen tanks, holding them above murky floodwaters, harrowing scenes coming out of the region. John.
To say the least, and that COVID train sounds like the plot from a dystopian movie.
Yeah.
Kristie Lu Stout live for us in Hong Kong. Thank you.